In this video, you'll get a quick overview of Vibrant's Hormone Zoomer. I'll explain the Vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest synergistic tests and end by summarizing the key takeaways and where to go for additional information. Hormones control many different bodily processes, including metabolism, homeostasis of the blood pressure, blood sugar regulation, fluid and electrolyte balance, and body temperature. Also, growth and development, sexual function, reproduction, sleep-wake cycle, and mood. When hormones are out of balance, this can manifest as fatigue, weight gain, poor stamina, poor muscle tone, osteoporosis, hair loss, hot flashes, night sweats, insomnia, low libido, infertility, and menstrual cycle changes such as amenorrhea, a lack of periods, oligomenorrhea, infrequent periods, menorrhagia, heavy periods, and dysmenorrhea, painful periods, and also emotional symptoms such as anxiety, depression, or mood swings. The Hormone Zoomer is a comprehensive hormone assessment that integrates urine and saliva testing to measure adrenal and sex hormones along with their metabolites, also a 4-point melatonin profile, and environmental toxins that interfere with hormone receptors. As part of the test, the cortisol awakening response, or CAR, evaluates cortisol and cortisone across 6 key time points throughout the day, providing a detailed view of adrenal function, stress physiology, and circadian rhythm regulation. The Hormone Zoomer also assesses the impact of hormones on bone health and equips you with clinically actionable insights to determine whether you may benefit from hormone replacement therapy, HRT, targeted detoxification strategies, and a personalized care plan to address fatigue, low libido, polycystic ovarian syndrome, menopause-related symptoms, and more. The Hormone Zoomer will include all the markers listed on this page. Vibrant's Hormone Zoomer test is an easy at-home test. Patients collect 4 urine tubes and up to 6 saliva tubes. For the urine samples, patients collect a first morning urine collected upon waking, ideally before 9 a.m., a second morning urine sample collected 2 hours after waking, an evening urine sample collected before dinner, typically around 5 p.m., and a night urine sample collected before bed, typically around 10 p.m. To measure the cortisol awakening response, patients collect up to 6 saliva samples. This includes a saliva sample immediately upon waking, 30 minutes after waking, 60 minutes after waking, an evening sample before dinner, and a night sample before bed. The 6th sample is optional. If the patient wakes during the night, they have the option to collect a 6th insomnia sample. The insomnia sample helps determine whether a nighttime cortisol spike caused the patient to wake up. For full collection instructions, including things to avoid before collection, visit the collection instructions webpage linked in the video description. As for collection date, men and non-menstruating women may collect any day of the month. However, there are recommendations for cycling women. Menstruating women with regular cycles should collect during the progesterone peak of the luteal phase. This corresponds to days 19, 20, or 21 of a 28-day cycle, or about 7 days after ovulation, if tracking. For longer cycles, add the number of days beyond 28 days. For example, collect on days 21, 22, and 23 for a 30-day cycle. For shorter cycles, subtract the number. For example, collect on days 17, 18, or 19 for a 26-day cycle. And for irregular cycles, collect 5 to 7 days before the expected onset of menses. And for postmenopausal women on hormone therapy, collect midway between doses. The Hormone Zoomer test also requires completion of the hormone testing questionnaire for more accurate results. For female patients, it collects information about the menstrual cycle, bone health, and toxin exposure, symptom history, medical background, and treatment considerations. Additionally, the questionnaire data is included in the final report for more customized clinical interpretation. The questionnaire must be completed for the sample to be processed. Please note that female reproductive health stage, i.e. pre- versus postmenopausal, is a mandatory field as the reference ranges change based on the answer. Note there's a separate questionnaire for males which asks about bladder and prostate infection. Vibrant's Hormone Zoomer utilizes gas chromatography tandem mass spectrometry, or GCMSMS, for quantitative detection of estrogens, progesterone, androgens, and metabolites in urine samples. and liquid chromatography tandem mass spectrometry methodology, LCMS-MS, for quantitative detection of cortisol, cortisone and metabolites, melatonin, endocrine disruptors, bone health markers, oxidative stress, and urine creatinine, as all results are corrected to urine creatinine. These are powerful analytical techniques that combine the separating power of gas or liquid chromatography with the highly sensitive and selective mass analysis capability of triple, quadruple mass spectrometry. Before we dive into the actual report, I want to highlight that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all 3 options combined, as it is most comprehensive. Let's start with a quick overview. The Hormone Zoomer sample report includes a cover page, index, introduction, questionnaire data, summary with interpretive comments, graphs, and flowcharts, then ends with a list of all markers. The report begins with a cover page that lists the sample type and results interpretation key. The index lists the 13 sections of the report: cortisol awakening response, adrenal hormones, diurnal cortisol, diurnal cortisone, diurnal melatonin, estrogen, progesterone, testosterone, hormone ratios, oxidative stress, creatinine, endocrine disruptors, and bone health. The introduction page is where you can find the methodology and interpretation of the report, and I highly recommend reading this page, especially if you want to learn about the methodologies used or how reference ranges were established. The summary begins with the salivary cortisol awakening response flowchart and graphs. The upper left shows the brain signals that drive cortisol production. The page also shows a graph of the cortisol awakening response. The green dots indicate results that are within the reference range, and the red dots indicate results that fall above or below the reference range. Ideally, you want cortisol values to follow the pattern of the light green shaded area. Specifically, cortisol should be highest in the morning with a peak after waking, and lowest in the evening and night to allow for restful sleep. For example, this patient has a robust cortisol awakening response. Their cortisol doubled within the first 30 minutes from 4 to 8. However, this patient regularly experiences work stress early in their day. As a result, their cortisol remained elevated at 60 minutes when it should have started going down. Cortisone is the inactive form of cortisol. Therefore, cortisone should generally mirror the cortisol graph, indicating that the body is able to deactivate cortisol. In this example, the patient's 60-minute cortisone is also elevated, indicating their body is trying to bring their cortisol back into the normal range by inactivating it. In general, metabolites for cortisol and cortisone can provide insight on the cortisol-cortisone dynamics, such as activation and inactivation. The next part of the summary shows the values for all saliva cortisol and cortisone measurements. Results are ported as both the number and plotted graphically so you can visually see how high or low your patient's results are. Note the waking saliva cortisol is flagged red because it is above the reference range. The summary also includes comments, supplements, suggestions, and lifestyle suggestions for markers that are out of range. The next page of the summary is a urinary hormones flowchart and graphs. The upper left shows the brain signals that drive DHEA and cortisol production. The page includes graphs of the 4-point urinary melatonin, cortisol, and cortisone levels. Similar to the salivary cortisol awakening response graphs, green dots indicate results that are within the reference range, and red dots indicate results that fall above or below the reference range. Ideally, you want values to match the pattern of the light green shaded areas, so urinary cortisol should be highest in the morning with a peak after waking, and lowest in the evening and night to allow for sleep. In this example, the patient's elevated morning melatonin may make them feel groggy in the morning, and their elevated night cortisol may prevent them from falling asleep at bedtime. The next part of the summary shows the numerical values for all urinary adrenal hormones, including corticosterone, DHEA, and DHEAS. This is followed by the 3 diurnal markers: cortisol, cortisone, and melatonin. Here are all the urinary diurnal cortisol measurements, including comments and supplement suggestions for elevated markers. Notice that nighttime free cortisol is above the reference range, which corresponds to the graph from the previous page. Here are all the urinary diurnal cortisone and melatonin measurements. Notice the first morning melatonin is highly elevated, which corresponds to the elevation on the graph from the previous page. Next in the report is a super helpful sex hormone flowchart. Starting in the upper left, we can turn pregnenolone into progesterone, which becomes beta-pregnenolone or alpha-pregnenolone. Alpha-pregnenolone converts to allopregnenolone, which crosses the blood-brain barrier, is a neurosteroid, improves sleep, and reduces anxiety. Therefore, the preference for alpha or beta can impact sleep and anxiety levels. Additionally, if someone is used to having healthy levels of alpha-pregnenolone in the luteal phase, they may really notice it if or when the progesterone drops within an ovulatory cycle or in perimenopause. Here's the list of the progesterone metabolites, including allopregnenolone. Alright, back to the sex hormone flowchart. We can also turn pregnenolone into DHEA, and DHEA can be made into androgens like GHAS and testosterone. In addition to the androgen levels, this section provides information on 5-alpha dominance. 5-alpha reductase is an enzyme that takes testosterone and converts it into the much more potent DHT. DHT is reported under the 5-alpha dominance section. Note that DHT cannot aromatize into estrogen, so once it's made, it continuously acts on the androgen receptors. Therefore, when DHT levels are elevated, this can lead to symptoms like cystic acne, especially along the jaw and chin, hirsutism, female pattern baldness, mood swings such as anger and irritation, and PCOS symptoms. Here's a list of the testosterone and metabolites, including 5-alpha DHT. We can also turn pregnenolone and DHEA into estrogens. The estrogen section provides additional insight on liver biotransformation and detoxification pathways. By quantifying how much 16-OHE1, 4-OHE1, and 2-OHE1 your patient is making via the cytochrome 3A4, cytochrome 1B1, and cytochrome 1A1 enzymes, respectively. These ratios are reported in the upper right-hand corner of the estrogen section. The yellow cytochrome 1A1 pathway, creating 2-hydroxy-E1 and methylation products, is the least carcinogenic. Therefore, we want to dominate this pathway as best we can. 2-hydroxy metabolites are anti-carcinogenic and have inhibitory effects on cell proliferation. 2-hydroxy metabolites are methylated at a faster rate than 4-hydroxy and much more stable on their own. Stable equals less oxidative stress. The pink cytochrome 1B1 pathway creates 4-OHE1, which can turn into quinones and then back into 4-hydroxy-E1, which can bind to and damage DNA. We want to minimize this pathway. It can't be zero because we use this pathway to detoxify more than just hormones, but we want to minimize it or at least help support getting off this pathway. The blue CYP3A4 pathway is considered proliferative. Sometimes we want to support this pathway, and sometimes we don't. For example, you may want to encourage 16-OHE1 to turn it into estriol if you're looking to support bone health in older women with low total estrogen levels. However, we don't want to encourage this in patients suffering from proliferative conditions such as heavy periods, clots, fibroids, breast tenderness, or breast fullness. One of my favorite parts of the report is the speed dial showing methylation activity. The dial shows how well your patient is turning 2-hydroxy-E1 into 2-methoxy-E1. However, you can get even deeper insight by looking at all the estrogen markers. Vibrant Wellness Hormone Zoomer includes a total of 4 hydroxy metabolites, meaning metabolites with an OH, and 4 methoxy metabolites, meaning metabolites with an MEO. When you compare the levels of the 4 methoxy metabolites to the levels of the 4 hydroxy metabolites, it provides insight on methylation status. For example, when methylation isn't working properly, you will have more hydroxy, OH, metabolites and fewer methoxy, MEO, metabolites, as is the case for this patient. On a related note, it also provides insight on phase 1 versus phase 2 estrogen metabolism in the liver because hydrolysis is a phase 1 functionalization reaction and methylation is a phase 2 conjugation reaction. Another way to get this information is by looking at the 3-methoxy to hydroxy ratios included in the hormone ratio section of the Hormone Zoomer, providing comprehensive insight on methylation activity. When methylation is good, we can assume B12 and folate sufficiency. Also note that the methylation dial only looks at the conversion of 2-hydroxy-E1 into 2-methoxy-E1 down the cytochrome 1A1 pathway. However, that's not the only pathway impacted by methylation. Sometimes methylation isn't happening down the cytochrome 1B1 4OH pathway, which you can see from the other two ratios highlighted in red. Here's another way of looking at it. While methylation of the 2-hydroxy-E1 into 2-methoxy-E1 is in green, the methylation of 4-hydroxy-E1 into 4-methoxy-E1 is in the high red, meaning estrogen metabolites are having a difficult time following this path. Instead, most of the 4-hydroxy metabolites are going down the bottom pathway and getting made into reactive quinones and likely causing DNA damage. Another way to confirm DNA damage is by looking at the oxidative stress marker 8-OHDG. Briefly, of the nucleotides used to make our DNA, guanine is the most prone to oxidation. When oxidized, the guanine in DNA becomes 8-hydroxy-deoxyguanosine, or 8-OHDG for short. When DNA repair enzymes find 8-OHDG, they replace the 8-OHDG with regular guanine, and the 8-OHDG is excreted in the urine where we can measure it. This patient has high level of 8-OHDG at 13.76 when it should be less than the reference of 4.77. In addition to the adrenal and sex hormones and metabolites, the hormone Zoomer also screens for 13 endocrine disrupting chemicals like BPA, phthalates, and parabens. While hormones are either in range or out of range, endocrine disruptors are characterized based on percentiles. Results in the green correspond to the 0 to 75th percentile and indicates mild exposure. Results in the yellow correspond to the 75th to 95th percentile, indicating moderate exposure. And a result in the red corresponds to the greater than 95th percentile, indicating exposure higher than 95% of the population. And note that the reference range is set at the 95th percentile. For each chemical that is elevated, the report will include a comment explaining common sources and symptoms of toxicity, identify the affected hormones, and explain the mechanism or mechanisms of action. For example, parabens bind to estrogen receptors, imitating estrogen's function and amplifying its effects. The summary also includes supplement suggestions or supportive supplement suggestions. Endocrine disruptors can be agonist, mimicking hormone function, antagonist, blocking hormone function. They can modify receptor expression. They can affect hormone distribution and levels in circulation. Endocrine disruptors can also block hormone signaling directly. They can impact hormone transportation, affect hormone clearance, interfere with epigenetic modifications of hormone-producing cells, impact hormone synthesis, or alter hormone-producing cells. A lot of actions. The hormone Zoomer also includes two bone health markers, deoxypyridinoline DPD and pyridinoline PYD. These markers assess bone degradation. Basically, high levels of DPD and PYD indicate the rate of bone resorption, thus increased risk for bone loss and a higher risk for osteoporosis and fractures. Monitoring bone health is critical for aging populations, perimenopausal women, and patients on hormone therapy. Again, the report will include an interpretive comment and supplement suggestions for each marker that is out of range. For example, this report recommends 1,500 milligrams calcium daily to support bone health. The summary ends with a summary of all the supplement suggestions organized by category. Note, the lab uses a weighted ranking approach for supplement suggestions. The ranking considers both how often a supplement is recommended and its evidence-based rating. This means higher rated supplements will appear at the top, ensuring that those with a 5-star rating come first, followed by a 4-star, 3-star, and so on. This weighted ranking system for supplement suggestions provides helpful evidence-based suggestions for healthcare providers and patients to make informed choices. Finally, the report ends with all markers. Before I share synergistic tests, I'd like to introduce you to Dr. Sydney Baker's TAC rules. Rule number 1, If you're sitting on attack, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 tacks, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to Vibrant's Hormone Zoomer, also consider the Gut Zoomer, which reveals microbiome and estrobolome influences on hormone levels. For example, your patient may be making appropriate amounts of estrogen, but if they have an overgrowth of beta-glucuronidase-producing bacteria, they may not be able to remove all those estrogens from the body, resulting in symptoms of estrogen excess. Also, the Cellular Zoomer, which links hormone and stress patterns to mitochondrial output, redox balance, and detox capacity, showing how endocrine strain translates into fatigue and poor recovery. Also think about the Toxin Zoomer to investigate and reduce total toxic burden, not just the endocrine disrupting chemicals, especially when the Hormone Zoomer results indicate blockages in liver detoxification pathways. And finally, the Cardio Zoomer, which provides cardiometabolic context when cortisol rhythm, estrogen balance, or oxidative stress may be influencing blood pressure patterns, lipid behavior, or vascular resilience. In summary, Vibrant Wellness uses gold standard methodology to measure your patient's adrenal and sex hormones and metabolites, including the cortisol awakening response, along with melatonin, endocrine disruptors, oxidative stress, and bone health markers, giving you insight on sex steroid hormone imbalances, adrenal HPA axis imbalances, bone health, and exposure to endocrine disruptors and DNA damage, allowing you to identify the root cause of your patient's hormone-related symptoms and to craft personalized protocols to get your patients feeling better fast. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.